Hello and welcome to our live event again, online patient meeting. I am your host, Caroline, and I'm happy to be here. And with us is Dr. Femi Olaragan. Hi, how are you feeling tonight?
I'm very good, thank you. How are you?
All good and well, all is working. I am very happy to be able to discuss another topic tonight.
Yeah,
We are connected with Cape Town with Cape Town, South
yeah,
Africa. So definitely something new for us as well.
good.
And thank you for joining our Stronger Together initiative. And well, please let us know that you can hear us. We just want to make sure all is working. And let me just remind you that Stronger Together initiative has been created simply because we want to make sure that since you are not able to proceed with your IVF treatments at this point, we just want to make sure that you will have a chance to ask your question to top fertility experts and use this time for your for us to be able to get ready for the treatment when it will be actually possible. So that is why Stronger Together has been created. And thanks to our ambassadors and partners, you can see them right here. It is actually possible, as you know, without any ambassadors and partners, this would be hard to do. So huge thank you for them. And well, you can see them right here. I know that some of them you already might know. And as I've mentioned, tonight we are having a very interesting topic for sure. It's considering egg donation options in South Africa, legislation, cost, and availability. And as I've mentioned, today with us is Dr. Femi Olaragan, reproductive medicine specialist at Heart Fertility Clinic in Cape Town. So fantastic to have you here. I am very excited to find out a bit more on how it works in South Africa. And we will start with the most common questions, of course, so that we can learn a bit more. And then it will be your time for your questions. So remember, you can type them in the chat section, and then Dr. Olaragan will be able to simply help you out a bit with the answers. Okay, and that is it from me at this point. Are you ready to start with the introduction as well?
Yes, we can do.
Okay, go ahead then.
All right. So my name is Femi Olaragun, as you have heard. Thanks for that introduction. I work at Heart Fertility Clinic, which is in Cape Town. It's a clinic that is based in one of the ultra modern new hospitals that's just been built. Very modern facilities out there. I also do a bit of work in the public sector. So I cover, sort of public and private sector. I've been doing IVF and reproductive medicine for the best part of 20 years now, just over 20 years. So in both spheres, in the public and the private setting. Based in Cape Town, like I've mentioned, Cape Town is a beautiful place. For those of you who've never been to Cape Town, it's lovely, it's warm, it's beautiful. And once we get beyond these difficult times, it's definitely a place that you want to come and visit. Today, we'll be talking about egg donation options in South Africa. As you know, egg donation is a well-established form of artificial reproductive technique that is being done all over the world. It would be interesting to hear what your questions are, but I'll be happy to try and explain to you how it works in South Africa, how it works in our clinic, what the options are, and how things go. So I'm looking forward to the session and ready to take questions.
Perfect. Thank you so much for that introduction. And yes, it's time for our most common questions. So let's get to them right now. And so here's the first one. Legislation around egg donation in South Africa, age limit of patient recipient, patient relationship status, and anonymity of donors.
Sure. So that's an interesting one. So there's an age limit for recipients around the world. The concern, obviously, around that is, if you have somebody who's much older and, given, but say you're talking about a 60 or 65-year-old having a child, what is the ethics around that? So, that's always a concern. So there are different bodies around the world have put limits on what they think the practitioner should do. And that's been copied, in most places you find it's about the same thing. For egg donation, you're looking at about 52, up to the age of 52 years old. There's really no questions asked, especially if the woman is healthy. There are really no issues there. You can go ahead and do it. Up until the age of 55, however, in other words, between 52 and 55, you have to be sure that the recipient is healthy. So in other words, she needs to be not having any major chronic illnesses, and she needs to be in a good sort of state of health before one considers that. So that will probably be the upper limit. As you know, it's not about the uterus. I mean, the uterus can carry a pregnancy, whenever, much later. But the indication, the problem will be that by the time, if you have a 65-year-old, getting pregnant, by the time the child is 5 years old, the recipient or the mother is 70. So you don't want to do that. So the cutoff for most people will probably be around the age of 55, maybe 56 at most. Patient relationship status. So there are patients who do approach us for egg donation cycles and who have relatives who want to donate for them. So that's possible. We can do that. What we do advise, though, despite the fact that this might be close relatives, is for them to have a lawyer's letter. In other words, for them to have a contract drawn up by a lawyer that explains, what the pros and the cons may be and what could happen later on. So, one needs to get a lawyer's letter or a lawyer's contract between the two of them, as well as see a psychologist who will then help, to perhaps draw their attention to certain things that they might not have thought of. Once that's in place, we can go ahead, as far as that is concerned. But by and large, most of the donors that we have are anonymous donors. So most of the donors that we use are completely anonymous donors. They are donors that are recruited by the donor agencies who've done all the work in terms of screening and all that of these donors. And then they come via the clinic to donate. So to put it mildly, to put it in a simple way, maybe I would say about 95% of the cycles we do is probably of an anonymous nature. So the donors are completely anonymous and they don't have access to who the recipients are. I hope that answers that question.
Yes, perfect. Thank you so much for this. And could you tell us, so do you need to be like, is it possible for single women to go ahead with egg donation in South Africa?
Yes, there's no issues there at all.
Okay.
There's no problem there. So single women, same-sex relationships, that's all done with no problems in South Africa.
Perfect. Thank you so much for that answer and all the details. And so, what medical tests are performed for an egg donor during her screening procedure in South Africa?
Right. So the normal tests that are done include the infectious disease screen. So these patients will have things like HIV, tests for syphilis like VDRL, hepatitis B, hepatitis C. They will have a full blood count, which obviously we need. And those the fairly basic ones, but depending again on what the recipient is looking for and if they want extra things done on the patient. So we've had, for instance, patients who've been worried about sickle cell anemia, for instance. And the vaccines, even though in South Africa we do not have sickle cell anemia. In other words, most people from South Africa, most of our donors, in fact, I don't know of any donor that has sickle cell anemia. But some people want to be sure, especially in the Black donors, and they sometimes want us to do that. So we can do extra tests depending on what the recipient wants. But the full infectious screen is done on these patients, and it has to be done shortly before the cycle is commenced. And then they have to have a psychological assessment. So they all have a meeting with a psychologist, usually once a year, sometimes twice a year. So if they haven't had one within a calendar year before they donate, they need to go back for one. So have all the infectious screens done. They offer a psychologist, and then the doctor treating the patient needs to see the patient or see the donor and examine. So we see the donors make sure that there are no obvious abnormalities. At the same time, make sure that we're not missing out on anything obvious, and interview these donors before every sort of donor cycle is commenced.
Okay, perfect. Thank you so much again for explaining this to us. And what information do we get about an egg donor in South Africa?
So the information is pretty it's pretty detailed. These patients often, I mean, these donors often have a very extensive history taking and a very extensive background. What's made available to the recipients would include obviously the physical characteristics, um, age, height, eye color, hair color, race. So those basic things. They also can have access to a picture of the donor, but when the donor is young. So it's got to be a picture of the donor less than 10 years old. That's because obviously because an anonymous donor, you can't have an adult picture, but you can have access to a picture of the donor when the donor is quite young. So it gives you an idea exactly what to expect. It also talks about if there are anything that might be significant in the greater family history of the donor. So it's quite a detailed screening that you get, and you get a fair bit of background as to what the donor is about and as to what a family history is about as well.
Okay, perfect. And so what about education? Is it also possible to find out?
Yes, level of education. Yes, not perhaps not details in terms of what degree they have, but if they did go as far as having a degree in terms or post matric and then beyond. So educational status is highlighted to a large extent. Yes.
Perfect. Thank you so much again for that. Okay, and so which donor races are available in South Africa?
So the good thing about South Africa is that we're lucky to live in a country where we call the rainbow country. So every color creed you want is present in South Africa. Obviously, the predominant race is the black population. So there's never a shortage of black donors, but you get donors right across racial lines. So white donors, Indian donors, black donors, and there's the color donors that we call it in South Africa, which refers to probably the mixed race between sort of black and white or black and so you have all that, and like I said, you have access to a picture, so at a picture at a young age, so you can pick from there.
Perfect. Thank you so much again for explaining that to us. And so is gender selection allowed in South Africa?
So unfortunately, that isn't what we can do. I think probably about 7-8 years ago, we were able to do that. But unfortunately, the the government a few years ago brought out a law that one could not legally do sex selection strictly for sex selection purposes. So if there's a medical indication, an X-linked condition or a condition where one could then be selecting a different gender to avoid a particular disease, then that's probably something one can do. But just for strict gender selection, it's not legal to have that done in South Africa.
Okay, understood perfectly. Thank you for clarifying that. And do you prefer fresh, synchronized, or frozen egg donation cycles? What's the difference in terms of success rates?
That's a good question. So traditionally, the fresh synchronized cycles are what most clinics do from the scratch, but because it's just easier to coordinate and it's less expensive initially. But more and more people are moving towards fresh egg donation, towards frozen egg donation cycles, with obvious advantages. I mean, if you have frozen egg donors available in your lab, it's quite easy to then, set up the recipient and just work with the recipient alone, and the timing is a lot easier to synchronize. But to answer your question, we have both available in our clinic, and I think in most clinics in South Africa. The idea would be if you have a fresh synchronized cycle, the risk there obviously is that if in the very unlikely event that the donor doesn't respond so well, then what you get is what you get, unfortunately. So that'll be the downside of it. But the upside is that every egg that is retrieved on that particular cycle belongs to the recipient. So if the donor does, which is what the case is most of the time, donor does well and makes, and produces a lot of follicles and a lot of good quality oocytes, then you have access to a good number of embryos, which then means you can always come back for frozen embryo cycles and the like. So there are obviously pros and cons. So both are available. From the logistics point of view, and with the fact that we've got very good, egg vitrification sort of labs available in the country, the frozen eggs are probably a better thing to plan with. So a lot of laboratories already have that, where they have strictly frozen egg donation cycles with very few sort of synchronized fresh ones. So it depends on which lab you're dealing with, but both can be offered, and the pros and cons is what I've just described.
Perfect. Thank you so much again for that explanation. So, will I receive all donor oocytes, or is there a set limit?
No, there isn't really. I mean, so if it's a fresh cycle, like we've discussed, whatever number that donor uh, brings up in that particular cycle belongs entirely to the recipient. So, I mean, if you're talking about the frozen ones, obviously you get a set number. But if you're talking about fresh cycles or fresh synchronized cycles, like I've mentioned earlier, all that is produced in that cycle goes to the recipient. So there is no set limit. But I mean, really, if a donor produces sort of 15, 20, most of the time you would not be needing that level or that amount of embryos for a particular patient. But in theory, whatever that donor produces belongs to that recipient on that cycle.
All right. Thank you again for answering this question. And the next one is, what is the cost of egg donation and IVF in South Africa?
All right, that's always the ultimate question. So it varies depending on which clinic you go to, which I'm sure it's the same all over the world. I'll speak for the heart clinic for sure. In our clinic, you're looking at about, if you're talking about a straightforward IVF cycle, including medication, perhaps 60,000 rands, which I'll try and convert quickly for you into US dollars. If you're looking at an egg donation cycle, which is what we're talking about, the cycle itself is probably about 80,000 rands. And if you look at the donor agency fees, which is about 20,000, that comes to about 100,000. 100,000 rands converted to euros will be probably about 5,500 odd, or 5,600 thereabout. US dollars just over 5,000. Converts it that way. For a normal IVF cycle, you're probably looking at about 3,500 if you convert what that's going to cost you in US dollars. So I think compared to parts of North America, for instance, it's relatively affordable, probably even compared to parts of Europe as well.
Okay, thank you again for providing such numbers for us. Okay, definitely interesting. Okay, and so how long does the couple have to stay in South Africa to have an egg donation treatment?
Yeah. So again, that's a good question. So it depends again on if we have frozen, if you have frozen embryos, to a large extent, it's easier to control, it's easier to work out. If the recipient is coming with their partner, obviously we will then need to have the recipient here at least free, usually 5 days, 6 days before the embryo transfer, provided we have a partner outside the country that can, get the stimulation or the preparation of the recipient going. So it varies. If you have a doctor outside the country, or outside Cape Town, for instance, who can do the scans and monitor the endometrial lining and all that, then you probably only have to be in the country or be in Cape Town for maybe just about a week or maybe just over a week. However, if all the monitoring and the stimuli and the preparation of the recipient has to be done by us, then we will need a few more weeks to do that. So even if you do start some preparation while they were away, you'll probably still be looking at about perhaps 3 weeks to get things sort of properly prepared here and to get the transfer done. So it could be as short as just over a week. It could be a bit longer than that, depending on how much planning one can do outside outside the country or outside the states.
Okay, fantastic. Thank you so much. That will be our last question from those most common ones. So it will be your time for your questions. So remember just to type them in the chat section so that Dr. Olaragan can actually answer it for you. Okay. And now, as I mentioned, let's get to it. How is an embryo donation in South Africa? Legal aspects, costs, and availability.
So that I think we've mentioned most of this actually. Availability is there, is freely available. We have lots of egg donation agencies, which is where you start from. Also, we're talking about embryo donation. Sorry, I apologize. So embryo donation is legal in South Africa. So there are two things that can happen there. The one is embryos that have been formed in the clinic and that the couple they have already signed a disposal letter, legal letter saying that it could be given away. So that's legal, completely done. So it is possible to do. We have a few cycles that we do that way. It's not very common, but it is possible, and it is legal. So there are strictly no problems there. If it is a known sort of donation, so in other words, if it's a donation from a couple that knows another couple, then again, it's always better to get legal representation. Always better to get a contract between the two and between the two couples or the two parties, as well as the clinic, so everybody is covered legally, and then you can go ahead and do it. So to answer your question, it's very possible, it's legal, but there might be some paperwork involved to get this sorted.
Okay, perfect. Thank you so much for answering all those questions. Definitely interesting to hear a bit more on how it works in South Africa. And now, as I've mentioned, it is time for your questions. So remember, type them in the chat section. And we have a few questions already. So let me get started with them. Okay. All right. So here's the first one. So I already make my choice for the fresh egg donor in your clinic for August or September. My question is, what will happen with those donor if it's not possible to travel, I guess?
Oh yeah, so yeah, that's a concern for everybody. So nobody's. It's not happening at the moment. In other words, most cycles have been on a slowdown up until now. So I think the chances are that your donor will still be available even beyond August, September. We don't know what will be happening in August or September. It might be that we can travel and we can move around maybe fairly freely at that point. So it might not be a problem. Obviously, if the donor then gets selected, we will probably then contact you to say, look, listen, the donor's been selected, and then maybe work something out to try and see what your time scale is doing at that particular point in time. So, my gut feeling is that it shouldn't be a problem. I think, you should be able to still come at the right time. If not, and something changes with the donor, as can happen, then we would obviously communicate with you and let you know what the story is and try and work something out from there. I hope that answers your question, Christina.
All right, thank you so much. Thanks for your question as well as your help with it. And next question is, What do you think will be impact of genealogy, sites such as 23andMe and Ancestry DNA will have it in the field of egg donation? Is it like the donor anonymity will be challenging to ensure in the years to come?
Yeah, that's a good question, Fernanda. So I suspect that this will get better. So genealogy sites, what they do at the moment, I don't know too much about them, but I presume they can chase back your genes, quite far back. So it's quite possible that they will be able to zone down what your genetic composition is. But you still have to be able to. I think the anonymity of the donors will still be protected. In other words, you still have to be able to get confirmation from the donor that that's where the genes come from. So, in as much as you could get quite close, I think to be absolutely sure or to think that that's going to make the donors less anonymous, I don't think is quite correct. The only concern there is whether or not it gets to a point where the court rules that one has to lift for whatever reason the anonymity of the donor or reveal the anonymity or the identity to the recipient. Outside that, I don't think these sites are going to be as close as what you're describing. It'll be interesting to see in the next few years how that pans out.
Okay, thank you so much for that question. Definitely interesting, and your explanation to it. We just need to wait and see then, I guess.
Yeah, absolutely.
Okay, perfect. Thank you. And so, you said that it's possible to view photos, and do you provide donor photos on the website, or how does it
Yeah.
work?
So, like I said, the donors, you can get their pictures, but when they were younger. So, young pictures normally below the age of 10. So, pictures taken at that age group will be projected onto the. So, you can view that on the website usually of the egg donation agency that we use, as far as I know.
Okay, perfect. Thank you so much for that. And okay, I can be happy to get an African frozen donor eggs, but not embryos. Is that possible?
Yes, very much possible. So you have to liaise with the clinic. Obviously, the availability of these varies. But more often than not, we do have African donated oocytes that are vitrified and that could be used. So yes, we can offer you that. You must just liaise with the clinic, and then we'll make sure it's available.
Mm-hmm. All right. Perfect. Thank you so much. Next question is indeed interesting. So, do you have to match phenotype of the donor to recipient?
No, not at all. It's not necessary to do that. The phenotype does not affect the success of the
Mm-hmm.
of the cycle, so we don't actually do that routinely.
So,
Um, yeah.
is it possible to, like, let's say, request if there is someone of African ethnicity would like to have Caucasian donor? So, it is possible.
Yes, I mean it's their choice often. Obviously, if that arises again, I will go the route of perhaps asking them to see a psychologist, which we often obviously recommend anyway, and perhaps explore what the reasons or the indication might be.
Mm-hmm.
Perhaps look a bit into the background of the person or where that child will grow up. So you got to think about where that particular sibling will be growing up, and if there are any disadvantages that we would be obviously subjecting that child to from the beginning. So those are sort of things that will go through one's mind. But in theory, yes, it shouldn't be a problem, but one might be a bit, a bit more careful and perhaps get a psychological opinion in that.
Just to reassure, yes, that of course the reasons for it are just, let's say, okay.
Yeah,
All right. Thank
yeah,
you.
that's right. Yeah.
And next question is, so I'm Caucasian, 1.7 height, brown hair, straight brown eyes. How long would I have to wait to find a donor?
Oof. So, look, I mean, difficult to answer this question directly because I don't know exactly how much of a match you want. So if everything you want that you've put on this list is exactly what you want, it might be difficult to match exactly that. But having said that, there are lots of Caucasian donors available in our clinic. So I wouldn't think that it's going to be a long wait. I guess you could actually perhaps contact the egg donor agency and see what they have, and they'll send you a list of what's available and see how closely you can get to this. But generally speaking, you won't have to wait long to find a donor.
Okay, thank you so much again for confirming that. At least now we don't have a question, so let's wait a bit, and please let me know if you have any other questions that you would like to ask so that Dr. Larragan can actually assist you and help you out a bit as well. And in the meantime, so just to make sure, I know that you have said that you have reopened the clinic, right?
Yeah,
At this
yep,
point.
yeah.
And but no patients from abroad as well, I guess.
From outside the country, you mean?
Yes, exactly.
Yeah, no, unfortunately, that isn't happening. So most of the patients we are dealing with now are local patients
Mm-hmm.
who do not have to travel.
Okay.
Um, so until the travel restrictions are lifted, there's not much we can do about that, unfortunately.
Okay. Yeah,
Uh, but
that's
we're monitoring the situation very closely, and once people can travel, we'll be welcoming patients with open arms.
Are they saying anything when possibly that can happen? Have you heard anything?
So difficult to. So we are from tomorrow going to level 4, which is one notch below the hard lockdown that we've had for the last 5 weeks. And from what I can gather, people can only freely travel at level 1. So I don't know how quickly we would move through those levels from level 4, 3, 2 to 1. But my feeling is that it will probably still be a couple of months still for us to get to that point where people can freely travel. So it'll be a guess if I were to tell you that I knew when it would happen. It depends entirely on the government.
Yes, of course. That's true. I just wanted to know whether and there are any rumors, perhaps. Of course, everything we need to wait for the official information. I mean, most of the countries are still closed. The borders are closed, so it's happening everywhere in Europe as well. But I just wanted to see if there are any rumors, perhaps. Thank you, and for that. So someone is typing, so let's give it a minute and just find out if we
Okay.
have another question.
Sure.
Yeah, just a second. And if you perhaps in the meantime could also tell us, so this is a very common question, perhaps you can answer in
Yeah.
regards to the success rates. Are you able to provide us with some success rates when it comes to egg donation at your clinic?
Yeah. So it, luckily with egg donation IVF, success rates are pretty high. You know, most clinics around the world will be quoting between 50 and 60% success rates. And that's where we are at as well. You know, these are young oocytes, young donors usually. And if the patients are properly worked up, you know, in terms of the uterine side of things, the recipients, then usually we have a good response and we have good success rates. So in the region of about 50 to 60% success rates is what you're looking at with egg donation IVF. So it is highly recommended if patients have poor ovarian reserve or they've had a few cycles that we're talking about off air earlier, had a few cycles that have not worked out so well, it would be good to consider egg donation.
Okay, thank you so much. This is like very common question. You probably
Yeah,
know this, right?
yeah.
And actually, I would like to also ask. I don't think it's you have mentioned. Do you have like if you are when it comes to egg donors, there is like an age limit? Do you for
Oh,
that?
yeah, there is. There is, yeah. So most of our donors, the recommendation is between the ages of 21 and 35.
Mm-hmm.
Um, well, actually, legally between the ages of 18 and 35, but you prefer your donors to be at least 21 years old.
Okay.
And the upper limit will be about 35. Most donors are probably under the age of 32, 33. So I would say roughly between the ages of 21 and 33 is where you'll find most egg donors.
Okay, perfect. Thank you so much. And in the meantime, we just got some questions, so let's have a look at them.
Okay.
Which tests are required for myself as a recipient?
Oh, that's a good question. So you need to have a consultation somewhere. So we need to be sure that the recipient has seen a doctor. Make sure that the recipient has a background that we're not worried about in terms of things that could go wrong in pregnancy, and then um, see one of our doctors when they're in the country as well, just to be sure. But the tests essentially include an infectious screen as well. It would be good. The routine test that we do for patients who are trying to get pregnant, pre-pregnancy bloods will include things like, again, HIV, test for syphilis, hepatitis B and C, and also rubella. So we need to be sure that the patient is, what the rubella immunity is. Sometimes we check on the blood group of the patient, sometimes because they want to know as well, and usually a full blood count. Things like thyroid levels are indicated in most panels as well. It doesn't really change what we do, but it will be good to have a TSH level as well. So fairly basic infectious screens with one or two other bloods is what we would need. And apart from that, that would be the tests. I guess one could include in that broad category of tests will be an ultrasound scan, perhaps a hysteroscopy, making sure that the uterine cavity is actually, is normal, before one, puts embryos in there. So if that's all been done, that's fine. If it hasn't been, obviously we will do that. Make sure that the uterus there's nothing to worry about in the uterine cavity before we then go ahead with the cycle.
Okay, thank you so much again for answering that question. And for your question too, you have mentioned a bit about the cost, but if you could perhaps repeat that. I'm not sure if you have mentioned, but what are estimated costs for egg donation for the recipient?
Sure. So I did mention earlier, for the for the recipient, what you're looking at is perhaps in rands, in South African rands, including the donor agency fees, perhaps about 100,000, 105,000 rands, which works out at about 5,500 euros, maybe just over 5,000 US dollars. That includes everything. So that's the lab fees, the donor agency fees, medication that the donor would need to go through, the donor compensation. All that is included in that fee. Perhaps the only thing that is probably not included in that might be the medication that the recipient would need to use to prepare her endometrium before we do the transfer. And that's usually not a lot. So that's for an egg donor cycle. That's what you're looking at. If it's for a normal IVF, that fee comes down to about 3,500 in dollars, in US dollars, about 60,000 rands. And that includes medication for the normal IVF. I hope that's clear enough.
Yes, perfect. Thank you so much again for letting us know exactly how it works, and of course the costs for repeating those. Thank you.
Yeah,
And
okay.
in regards to also this, I believe, where about is your clinic, and why should I come all the way to Cape Town for treatment?
Well, the clinic at the moment, like I mentioned right at the beginning, we are in the foreshore, which is right, close to the Cape Town waterfront. And it's a brand new hospital. It's state of the art Netcare hospital. Probably about maybe 3-4 years old only. Beautiful place, really. So we're on the 11th floor of that building. And the reasons to come to Cape Town, I could spend all day, all evening, sort of telling you why, but the weather is great, the people are friendly, there's so much to see. When the restaurants are open, you don't get much better. So the question will not be why should you come to Cape Town? The question will be why should you not come to Cape Town for treatment?
Okay, perfect. And if I'm not sure if you can say, but is it possible for you to tell us from where the patients usually come from when the ones that come to the clinic?
Oh, far and wide, really. We have a lot of local patients, obviously, but then we have lots of patients from Australia who, access the country, perhaps because it's kind of more affordable, and some of the legislation in Australia is probably a bit more stringent, so we get a few. And then from other African countries, a lot of South African clinics see patients from all over Africa, really. So you're looking at patients from as far as up country as Nigeria, as far as Angola. So we have patients from well within Africa as well. And then every now and again we get patients from North America. It's a bit of a distance for people to travel from North America, but every now and again we do get patients from there. So by and large, mostly Europe, Africa, and local patients.
Okay. Are there are there countries in Europe, let's say, that actually choose South Africa quite often?
Yeah. Well, the UK comes to mind. There are a couple of patients, who
Mm-hmm.
we see from the UK. They come probably because they have links in South Africa. Will come to South Africa for the treatment. I think other European countries have quite a robust, sort of egg donation system going, like places like Spain and Italy. So we hardly ever get patients from those countries, but we do get from probably Eastern European countries as well. So perhaps because again it's a bit more affordable to come down to Cape Town for treatment. They probably find themselves in Cape Town for whatever reason. So we do get the occasional patients from there.
Okay, perfect. Thank you so much again for that. And it looks like this will be our last question for tonight. So although someone is typing, so I'm not really sure,
Okay.
but let's have a look at this one first. Does my blood group need to be matched with the donor?
No, we don't. Not it doesn't matter. I might have mentioned it earlier on as well. It doesn't really matter what the blood groups are. So we will check, but it doesn't change what we do. In other words, we would not necessarily be looking for a blood group O for a patient whose recipient is blood group O. No, that's not necessary to do that. It doesn't affect the results, and it doesn't change what we do at all. Unless the recipient sort of wants that specifically for whatever reason, then one might then perhaps look into that. But it's not something that affects what we do.
Okay, understood. So it's not necessary in such case.
No,
Mhm.
no.
But if someone, let's say, would like that, requests this, would you be able to look into it?
Yes, absolutely. It's an easy thing to do. The person sends us what their blood group is. We would then check within our donor bank for a similar blood group. Obviously, it narrows down your choice, but I'm sure it will be possible to do it in most cases.
Okay, perfect. Thank you so much. And in the meantime, we do have another question. Let's have a look at that. I am quite nervous about the retrieval process. What happens if no eggs are retrieved from my donor? And does this happen often? Is there a form or guarantee?
Yeah, so that's a good question because it's a very rare thing that happens. So every now and again, you have a donor you've prepared and everything is going well, and then the donor for some reason might have taken our injections wrong. Touch wood happens very rarely, maybe once every couple of years, and we end up with nothing, or the donor just doesn't have enough eggs. Very, very rarely. But if that does happen, then we will have to discuss with the patient as to what we have. And the options will be, to look into the bank if we have frozen eggs at that point, especially if the patient is from out of town or out of the country, and look at what can be offered with the patient's consent and see what can be offered from there. The other option will be to discuss with the patient and get some kind of refund going that will then enable them to come back and have another cycle done and prepared, maybe with the same donor if they want, preferably with a different donor. But then they would have sort of a rebate, if you like, for what they've spent. That will be credited into what their account is, and they will have to pay less for that. So yes, if this happens, we have things in place that we can sort of tell the patient or help the recipient with. So there's no form of guarantee really. We work with it as it happens, if it does happen.
Of course. Okay. Thank you. And so to also, I have a question. So it's like, for example, do you offer any like guarantee of the eggs, like number of eggs that are guaranteed or embryos? The program?
No, we kind of back ourselves in terms of number. Look, with every IVF cycle, you're aiming for between 5 and 15 eggs. That's what you're aiming for. And 95% of the time, these donors will give you that kind of number. So, it's impossible if you're doing a fresh synchronized cycle to tell the recipient what exact number of eggs to expect. So we will tell them that these are good donors that you selected, but there's no ways you can be absolutely sure what numbers you'll get. If you're talking about a frozen oocyte cycle, a different ballgame. So you'll be usually the oocytes are frozen in straws. So you'll be paying for a straw that's got, for the sake of argument, 6 frozen oocytes or 8 frozen oocytes, and that's what you're paying for. That's what the clinic is offering, and then you work from there. But with the fresh synchronized ones, again, you expect to get lots of oocytes. But if you don't, then you work from there.
Okay, thank you for explaining this as well, of course. Okay, and there's another question. So, are there any do's and don'ts for preparing my body for egg donation?
Yeah, that's a good question. I mean, that would take a long time to try and answer all that. But what we do in sort of advise patients is to try and have a healthy lifestyle in the run up to their cycles. It goes without saying, sort of avoiding noxious substances like smoking, excessive alcohol intake, and not enough rest, for instance, might be things that one would want to address to get yourself in a state of mind or your body in a state where the chances are very good that you're going to conceive. Beyond that, things like a diet, nothing is entirely proven, but we will advise a diet that is very rich in vegetables and nuts in the run up to the cycle, lots of water, lots of exercise, lots of rest. So those are the kind of things that we would need to do. Avoid noxious substances, lead a healthy lifestyle, and try and get your body in the best state possible prior to receiving those embryos.
Perfect. Thank you so much. And it seems that was our last question. However, I would like to also ask one more thing, as we always receive that kind of question too.
Yeah.
How many embryos are you able to transfer? 1 or 2 or perhaps more? Is there like a limit? Some countries do have limits, of course. That's why I'm asking.
Very good question. So in our clinic, we would hardly, especially with egg donation cycles, we hardly ever, in fact, never put back more than 2 embryos. So a default mode in South Africa will be 2 embryos. There are probably a few clinics that are moving towards SCTs, single embryo transfers already, but few and far between. On the request of the patient, we can do single embryo transfers, obviously, but generally you're looking at 2. So we wouldn't go beyond 2 embryos for most of our patients, for all our patients really, with this kind of cycles. And if they want, we can do 1 if that's what they prefer.
Okay, excellent. Thank you so much again for this explanation. And well, I guess we will be finishing for tonight. Thank you so much for joining our initiative, for being with us tonight, for your time, and for providing all those details. This is definitely something that we haven't done before. We haven't this kind of topic before. And also with the information about South Africa, how it works there. So definitely interesting. Dr. Aragon, this was a pleasure. And well, hopefully we will be able to have more topics and be able to do it once again.
Yeah.
Thank you. Thank you
so much. The pleasure was all mine. Thank you.
Happy to hear that. And of course, there are some thank yous from the patients. And well, I would like you to thank you as well for joining our meeting, online meeting.
It was an absolute pleasure. Thank you so much. We'll catch up soon.
Perfect. And is there anything else you would like to add?
No, just it was I think this is quite good to have this is with the way the world is going now. So this has been a pleasure, and I think lots of people will be going down this road where you actually have discussions around and helping patients who might have questions out there. So it's been fantastic. It's a way to reach the patients. So I think you're doing a good job there. And I think there'll be more and more of these, and hopefully we'll be able to get a few more people into our clinic, with this kind of reach out. Thank you so much.
Thank you so much again. This definitely, we are happy that we can at least get together from countries, different countries all over the world, and that way we
Right.
can definitely support our patients, give them a chance to meet all kinds of top experts in the fertility field. So, thank you so much. Well,
Okay.
let me just remind everyone that this has been recorded. You will have a chance to rewatch it. It will be uploaded soon on our website, myivfanswers.com. And of course, if you would like to get in touch with Dr. Olargun and his team, you can actually do it with this link right here. There is an option for you to ask your questions directly to the team, and I'm sure they will get back to you with some more details, some more answers. And remember that you can follow us on YouTube channel or Facebook or Instagram, and that way you will be updated with all our live events. And tonight we will have another live event at 8 p.m. UK time, so stay tuned. I hope to see you there as well. And well, thank you again so much, Dr. Olargun. Have a good evening, and
Yes.
well, stay safe and take care. Bye.
Okay. Ciao, ciao. Bye, bye. Bye.